Good evening, friends. I welcome you all for an important session, especially surgeons who are aspiring to become a surgical gastroenterologist. This session is going to be a definite eye-opening session for you. And doing MCH in institute is a dream for most of the surgeons, like in AIMS, JIPMER, PGI. It's a dream. As you all know very well, the pattern of exam is completely changed. Most of the people, those who are preparing for MCH, used to prepare surgical gastro books in those days. But now what happened, NEET SS syllabus is totally completely changed now. So people are not preparing more numbers for MCH surgical gastro in institutes. So this is a major thing we are seeing in the past. The number of AIMS exam takers has come down very low compared to the past 3-4 years back, what we had number of students appearing for the exam. So here in this session, just a 15-minute session, myself and Dr. Santhosh Anand sir, so we both are surgical gastroenterologists. We are going to explain you how to prepare for this 2023 MCH exam in INISS. Okay, INISS MCH exam related discussion is going to be happening now. So any doubt if you have, you can always post, because we are also watching the YouTube session. So any doubts if you have, we will be posting your queries in the session. Yes. So how to prepare for INISS SG exam by team doctororials. So before going to the exam and discussion details, you should know the number of seats available in this exam. So totally we have 16 seats for 1 year. So each session in AIMS, we have 2 seats, Delhi, Bhubaneswar 2 seats, Rishikesh 1 seat, Patna 1 seat, and JIPMER there is no seat in May session. They keep the seats only in November session. We have 2 seats, and PGA 1 + 1 seat. So totally the number of seats available is 16 compared to other super specialties like onco, urology, and cardiothoracic, pediatric. All those seats are very high in number compared to surgical gastro, and you all know very well. And the most competitive course among the super specialty is surgical gastro. Most of them will like to become a surgical gastroenterologist. So last year, around 1,400 students wrote the exam. INISS part, gastro part, they wrote around 4,400. The highest competition with the lowest number of seats is for SG. So what are the first, let me start with what are the books to prepare for INISS exams. Yes, to be frank, this is the toughest preparation compared to any other exam. INISS surgical gastro is really tough compared to NEET SS preparation, because in this exam, you are going to read so many books. So previously, we used to read only surgical gastro books. We won't read general surgery part. So only surgical gastro questions used to come. Now, this is a 40% general surgery, 60% surgical gastro has been taken into account. And recently, 7th edition Bloomgart has come. So 7th edition Bloomgart is one of the important books you have to read, number 1. Number 2, Shackelford 8th edition, you have to read completely, number 2. And number 3, Bailey and Love 28th edition. So 2 books among the 4 books you are going to read are new editions, which are released last month. So one is Bailey and Love 28th edition, and another is Bloomgart 7th edition. These are 2 new editions. And undoubtedly, there are people who cracked INISS surgical gastro only by preparing Sabiston. We have taken interviews of the people who got ranked last year. There are some students who got INISS surgical gastro 3rd rank, 5th rank, and all they got only by reading Sabiston also there. So ideally, for answering all the 80 questions, there are totally 80 questions available. So we have updated
one complication which is known as
videos
anastomotic leak.
In doctororials,
anastomotic
we have updated all the videos.
The Achilles heel of this operation is anastomosis.
Completely updated videos from
exovitectomy operation.
You can see we have made videos, complete videos by all the surgical gastro faculties. We have updated in detail.
I will
videos
pass
are
the
available
circular stapler to this place, and I will keep the anvil here, and I will do a end-to-end anastomosis.
Completely high quality videos, unlike other
we'll do
platforms having
only
only Zoom recorded videos, and other platforms having only videos of video lectures which are made in Zoom and which are recorded in the classroom, and the class is going on, they have recorded and they have put in other app platforms. But our videos are completely 75 hours plus videos. We have given the PDF of the lectures also, which you can go through and reading. We have updated Q banks based on Shackelford and Sabiston. So lectures in the present video package is based on Shackelford 8th edition and Bloomgart 6th edition. Soon we are going to update the videos of hepatobiliary part based on Bloomgart 7th edition, but it will take some time. But As of now, you can read the Bloomgard 6th edition videos which are available. Any new updates we will be definitely making in the platform itself. So I request Dr. Santhosh Anand sir to give a few points related to hepatobiliary preparation, because sir is completely a master of Bloomgard. He used to take all the classes in surgical gastro part from liver, pancreas, biliary system. All those parts are covered by sir from Bloomgard. Sir, what is your opinion related to preparation of surgical gastro from Bloomgard? So please give your views from your point of view, sir.
Hello, sir. Good evening, everyone. Thanks for the opportunity. Regarding INI CET preparation, sir, as you rightly pointed out already, it is one of the toughest examinations because voluminous books and tough books, both Bloomgard and Shackelford, along with the standard books like Sabiston and Bailey Love has to be prepared. Bloomgard, actually, it's a kind of must, at least few portions of Bloomgard has to be read, sir. Initial portion like anatomy, physiology, then comes some boring portion in Bloomgard, like fibrosis, regeneration. All those things maybe they can skip provided they follow our lectures, which we have extensively covered it, and we have included both lectures and questions from that. It is not that questions are not being asked from that, it is asked from that, but since it will be boring, we have extensively covered it. But honestly telling, in order to clear or crack the exam, studying Bloomgard is must, in addition to studying the Shackelford ones. I'll just quote few examples in the last INI CET. So few questions like Appleby procedure was asked, which is there in Shackelford also. But see, this is a very simple question where regarding the endocrine pancreas, all are false except there were 4 options, and all the 4 options were exact words, not even the words were changed from page 66 of Bloomgard 6th edition. So this is one such example, and out of 40 odd questions, almost 18 to 19 questions were directly taken from Bloomgard 6th edition, word by word, not even a change in full stop, comma or something. So it will be always better to study Bloomgard once. Study in the sense like after understanding. So in order to understand Bloomgard, we need to study at least twice or thrice. But having said this, we won't have that much time. In fact, when we prepared from Bloomgard, we studied at least 3 to 4 times to prepare these lectures and questions. So when we concentrate in surgical gastrohepatobiliary part, when we see our lectures, then definitely the number of times you need to go through Bloomgard comes down. Okay, so like someone who starts studying Bloomgard afresh, he may need to study at least 3 times or 4 times for him to understand. But after going through our lectures, it may reduce to 1 or 2 times. So that is how it enhances. And once you follow our lectures, you will get to know what are the hotspots. Like not starting from page 1 to page say 1500 is important in Bloomgard. We would have though we would have covered everything, we would have concentrated on some portions which are repeatedly being asked in INI CET exams, say for the past 2 years and not, and previously AIMS JIPMER exams for the past 5 to 7 years. So what portion to concentrate? Number 1. Number 2, in order to reduce the number of times to study Bloomgard, all these things, our lectures and questions will definitely help, sir.
Yes, sir. Yes, sir. Thank you so much, sir. You have given a very important input. So to get a crack surgical gastroenterology seat, definitely in AIMS, the examiners take questions only from Bloomgard, especially hepatobiliary part. 50% of the questions are taken from Bloomgard. So though the other 50% will be there in other books, it will be line by line from Bloomgard. So Bloomgard is a part of important essential aspect of preparation. And here I have put 2 important interview videos. Dr. Vinay, who got rank 6 this time and he has joined AIMS now, he got INISS 6th rank. And when we are asking him in the interview, you can go through this interview, it is available in this. He has not touched Bloomgard. So this is very important because he has not touched Bloomgard, but he has used our surgical gastro video. Full video, he has used our video, our notes he has used, but he has completed Sabiston thoroughly and Shackelford he has read very well. So he is the one faculty who is the one student who told he has not read Bloomgard, but he has used our videos completely. He got rank 6. And above that, there is Dr. Drone. He got rank 1. He is rank 1 in previous session, January session. So Vinay is he got in November session, he got Jan session, Dr. Drone, he's now in Delhi AIMS. He got rank 1. When we were discussing with him, he was telling one simple answer, that is, I read only the materials of our INISS materials of our team. He has not read anything, only the notes and Bailey and Love, only these material he has cracked the exam. You can go through both the interview, because in spite of we talking about how to prepare, it is always better to hear from the toppers. These 2 toppers have given an excellent review of how to prepare. So definitely you should go through these 2 videos, which are available in the YouTube channel, and I will also share in our WhatsApp group. So in our INISS, we are making complete WhatsApp grouping for all our students. So WhatsApp grouping we are making for the students who are subscribed for surgical gastro, and we are completely guiding you until your exam. We are going to help you. So please know the syllabus of paper is very simple. Only 80 questions are going to be there for 1.5 hours. So in that 40% general surgery questions are coming based on Bailey and Sabiston in depth. It is not a superficial questions, it's in depth. This 40% questions is going to be useful for you in your NEET SS general part also. So you have to be focusing in depth about the 40% general surgery questions, and the 60% GAT and HBP is going to play the major role here. Shackelford is must. And as Sir told, Bloomgart, you can read here and there important points based on our video lecture. And Sabiston definitely it is going to help you in general surgery as well as in gastro part. So gastro part, Sabiston is a complete notes of Shackelford with Bloomgart. Concise notes is there. So you can see one student who appeared, got 6th rank, has got rank 6th, only reading Sabiston in depth line by line. So you have to concentrate on Sabiston. So let me give a sample question which is asked in the exam. Reverse, see, these are November 2022 last session question. Reverse gastric tube is based on. So this is a question which is not there in Sabiston, Bailey, or any other book, except Shackelford is having this question. Page number 447 is the only question, I think you can see the reversed gastric tube related full detailed concepts are there. The blood supply is based on left gastroepiploic artery, which arises from splenic artery. You can see this is a reversed gastric conduit. You can see we have explained all this thing in our lecture also. So we are making the greater curvature of stomach going to the esophagus, esophago, reversed gastric conduit, anastomosis done. The major advantage of this conduit is patient's reservoir capacity of stomach is preserved. Usually what we do is we take the gastric conduit based on right gastroepiploic artery. This is a reversed gastric conduit based on left gastroepiploic artery. The only book explains about this concept is Shackelford. So that's why we are telling we have to read Shackelford for gastro part, no doubt. And next important question, see, which is not done in case of difficult duodenal stump. Another question which is not there in any book, Bailey or Sabiston does not have this. So this can be answered only if you have read Shackelford. You can see which is not done in case of difficult duodenal stump in the management of giant duodenal ulcer. This is a direct paragraph. You can see which is not done. Answer is C. You can see this is from page number 690, Shackelford. In such cases, you can see if the inflammation and edema of the duodenum is not a factor, a Billroth 1 construction can occasionally be performed. However, dissection and anastomosis may be hazardous, and it is better to leave the ulcer bed in situ and perform a Billroth 2. In such cases of duodenal stump, leak is a major morbidity. So the duodenostomy tube is one option. Number 1, duodenostomy tube is one option. You can keep a T-tube or a duodenostomy tube. Number 2 option is Nissen closure. What is this Nissen closure means? The cut end of duodenal stump is fixed to the duodenal capsule. Is an anastomose to the duodenal capsule. So another way of dealing is Bancroft closure, in which the duodenal stump closure, in this method of Bancroft closure, the duodenal stump closure, the stomach is transected proximal to the pylorus where the tissue is less fibrotic. The gastric mucosa in the duodenal stump is then dissected away from the submucosa and duodenum. This is secured with purse string sutures. So Bancroft procedure can be done, Nissen procedure can be done, duodenostomy tube can be done, but Billroth 1 and 2 are dangerous procedures we cannot do. So like that, though the questions are looking simple, you cannot answer these questions without reading Shackelford. Yes, INI surgical gastroenterology preparation is really tough, but it is worth. So doing MCH from AIMS, JIPMER is another level. You will understand it only when you come out of the course, because the learning level and the hands-on is extraordinary in JIPMER and other AIMS institutes compared to other institutes available in state entrance, state quota. We are getting a seat. No, they're all having less hands-on and less surgical exposure. So if you want to become an extraordinary surgical gastroenterologist, it is always better to do in AIMS and JIPMER. And the important point now is the competition has come very low. Compared to those days, the competition has come low because the students are not ready to prepare NEET SS as well as INISS, because NEET SS is only general preparation. INISS, we have to read extraordinary extra points. So this INISS preparation, you have to start from your MS post-graduation day, first year itself. You have to start reading Shackelford and Bloomgart. Whatever case you are seeing, you have to start utilizing those books. So you have to note the important points. We have shared already, all our PPTs are already available in Telegram channels free. You can download the PDFs and you can use it. So all the important things are there. So Deepak Kumar is asking how to get previous year question. There are actually 3 exams only conducted in INISS. So whatever exams conducted, based on those questions, we have done the video lectures. So we don't have a separate question bank like that, but we have made most of these questions in the discussion of our videos. So you can see the videos, you can see most of the repeat questions, which are all areas which are highly asked. And one thing I want to tell you, there is no repetition of question in AIMS and INISS. Most of the time they will ask different area, because there's only a 60 questions they are going to take. So they are covering extensively from various aspects of the book. So it is always better to go through the book and read the points and keep the important points highlighted in your book itself and read our video lecture PPT. That is enough for cracking the INISS SG exam. And what about the general surgeries? Is it so important in INISS? Means you will understand now seeing these questions. See, general surgery sample question of INISS. So it is not going to be a NEET SS simplified question. 50% of the general questions are very tough, which are not there in any other book except Sabiston. See, ACIS NSQIP score, which is true. So this question is not there in any book like Bailey or Swartz. It is there only in Sabiston. That is why we're telling the questions are taken from Bailey, Sabiston only. It includes 13 variables of surgery-related outcomes and predicts 30-day mortality. It is based on a table given in, what is this? NS means American College of Surgeons National Surgical Quality Improvement Program score. See the score, designed to predict 8 post-operative outcomes, and the tool has evolved to currently report 13 specific or composite outcomes within 30 days of surgery. When it was initially introduced, it had 20 preoperative factors, original score. Now the latest score, this is the original score, which had around 20 factors. So we cannot remember all the factors. They are also not asking all the factors. They are just judging whether you have read this concept or not. See, this is the ACS NSQIP Universal Surgical Risk Calculator program, which is made on 13 post-operative outcome for mortality. So this is a question directly from Sabiston. Okay, so it is directly asked from Sabiston. You have to read the Sabiston related points. In pheochromacy, the other questions, there are also simplified questions taken from Bailey and Lau. So in INISS, there are 2 extremes of questions. Very tough question which nobody can answer without reading Shackelford and Sabiston. There are some questions which anybody can answer, even an MBBS final year student can answer. See, in the pheochromocytoma management, before going for surgery, how the drug should be given. So you all know this answer very well. It's a PG entrance question. First, we have to give alpha blockers. Until the patient develops postural hypotension, we have to give them alpha blockers. Postural hypotension or nasal congestion will be the important clinical feature to know when to start the beta. Beta blocker should not be started before alpha blocker. This is a very basic question. So always additional beta blockade is required if tachycardia or arrhythmias develop. This should not be introduced until the patient is alpha blocked. So this is very important question. So like this, there are basic questions also will be asked in the exam. So there are some questions from the students. Bloomgart 7th edition, we will be sharing in our SS group. In Doc Tutorials, SS group is there in Telegram. Please join that group. I will share the Bloomgart edition there. Important topics will be updating in the group. So list of topics, yes, Divagar, that's correct. So these are very important things I want you to know related to preparation of INISS SG. So the only available true SG package for INISS is Doc Tutorials package. No other package is completely SG package. They're all just recorded during the class time or old, very old videos recorded 3-4 years back when the SG exam was there. So only updated videos we are having, which are recorded last year, and we are going to even update some of the topics for based on Bloomgart this year. We are going to update. So, and also we are guiding the students through our WhatsApp group. Most of the students are there already in the WhatsApp group, will be knowing. So please utilize this SG INISS classes in our Doc Tutorials and I thank Dr. Drills for giving an opportunity to have a talk on this session. And I thank Dr. Santhosh Anand sir for coming for this session. So thank you so much, sir.
Thank you, sir. Thank you, sir. Thanks for opportunity.
I think there are no queries from the students. So this is a short session. We wanted to give an eye-opening for the students on how to prepare for SG exam in INSS. So any final thing you want to tell, you can tell, sir. Because here very important is, sir has completed MCH from JIPMER. So when he completed from MCH from JIPMER itself, he can do a Whipple's operation, he can do hepatectomies, everything. But we people who completed from state entrance exam, we had never had a confidence of completing those surgeries, because we learned most of the surgeries coming out and working as assistant professor. But people who come from institute, they are very confident in most of the surgeries when they come out itself. So you can give some final inputs for the students, sir.
So definitely, as you said, sir, peripheral AIIMS and JIPMER are very good institutes, not only in hands-on, but also in academics. Like, unlike other places where they teach you how these things to be done, what we were being taught is like, you face a problem, you analyze the problem, like what are the options, different options of management available. So we were made to go through the literature also, like what are the options which is not practiced, but which is available. So that by the time when you come outside and practice, you know, when you face a problem, like where all to go, what all to search, and how to manage. So we are made as a good doctor and a good surgeon, in addition to hands-on also, as sir said. So that is definitely feather on the cap of being completed in an institute, sir. So definitely all the best. Like if you follow our lectures, studying Bloomgart will be very easy. And few aspirants who had cleared last time, as sir said, they just followed our notes, and in-depth submission has helped them really. But routinely we recommend to follow our notes and to study Bloomgart, Shackelford also. So all the best for everyone, and hope you will be benefited by taking our package, which is a complete package of Subiston, Shackelford, Bloomgart. Thank you.
Thank you, sir. Thank you. All the best. Please have confidence in this exam. So most of them, the reason they don't write INSS exam is they feel this is a very big exam. It is for some people who are reading in depth. It is not so. If you can prepare in a smart way and a concise preparation, you can easily crack this exam. And also the competition is less. Actually, the people who are preparing for this exam, though 1,400 students are writing the exam, the real competition is between only 150 students. Only 100 to 150 students only will be preparing in depth for an INSS. So if you're going to put your effort in maximum 6 months, maximum 1 year, you can crack INSS in AIIMS or JIPMER. So all the best. Do well. See you all in the next session. Thank you. Thank you, sir.
Thank you, sir.
Thank you, sir.